one of the main myths that I heard growing up is that you can't get breast cancer under 40. This is bolstered by the fact that you can't get a mammogram in some cases unless you're 50 years old. So when I first found a lump in my breast at 26 years old, I wasn't worried about it because I always heard you can't get breast cancer in your 30s, 20s. I've learned the reality of that since then, and it's not a very pretty reality. In fact, women under 40 represent the leading cause of cancer death, breast cancer patients. So under 40, people aren't dying from lung cancer, pancreatic cancer, they're dying from breast cancer. And I think a lot of the reason is there's not a lot of information out there about people under 40 and the risk associated with breast cancer. It's an opportunity for to be diagnosed at a later stage because mammograms are not a common reality for people under 40, and most insurance companies won't pay for it. I had to really fight to get a mammogram when I identified the lump in my breast. And I know women that have been told a number of times, you're too young for breast cancer. What you have is a cyst. What you have is a fibroadenoma. What you have is benign. Come back, in 6 months. If it's not changed, we'll consider something different. So you really have to be your own advocate when you fall into a category of atypical understanding about breast cancer. And these are doctors that should know better that people can get breast cancer in their 20s and 30s. I have encountered over the past couple of years even metastatic patients diagnosed in their teens. So this is a really scary reality and actually a growing subset of patients dealing with breast cancer. Under 40 patients represent a serious set of complications when it comes to being diagnosed with breast cancer. So they tend to have poor survival statistics. The cancers tend to be a lot more aggressive in young women because the cancers form from healthier cells. So whereas the progression risk for an older person, 40s and 50s, tends to be around 30%, some of the studies that I've read indicates that young women actually have a recurrence risk of about 40 to 50%. And nobody's talking about that. So that's something that's got to change. Poor prognosis is something that we just kind of talked about. When you're under 40, you have a lot more estrogen in your body. And estrogen has been associated with a higher risk of breast cancer. About 60% of breast cancers are what we call estrogen receptor positive. And that means that it's being fed from estrogen in the body. So without an interruption to that constant estrogen feed, we find cancers developing earlier and earlier in life. Couple that with an increase in the administration of birth control pills, hormones in the food that we eat, and the milk and stuff that we drink, and we see those numbers continue to rise. So it's not a common situation to have breast cancer in your 30s or 20s. It's about 1 in 212 to get breast cancer in your 20s. I tend to fall into the rare category time and time again, and not in a good way.